Dear students, today in this live session, we will learn about analgesics. So, actually, what is analgesics? These are the substances, natural substances or synthetic substances or drugs or medicines or medications which are used to relieve pain. Okay, so due to some injury or any trauma or any surgery, okay, so any cuts, because of these things there is disturbances in the nerve signals and its transmission, so pain is occurring. So to reduce the pain and its mechanism, we are using analgesics. So there are natural analgesics and synthetic as well as semi-synthetic analgesics are there. So some of the natural analgesics are there, and strongest analgesia is the morphine, okay, and less than the morphine is codeine, okay. So another thing, again I am telling, analgesia are drugs that relieve pain, okay, without significantly altering consciousness. Means it is reducing the pain but with having consciousness, means you are not losing your consciousness, okay. So you can see, you can understand that what is going on, okay. So without losing hope or consciousness, it is just relieving the pain, okay. And analgesics relieve pain without affecting its cause. What does it mean? Its cause means for what purpose or for which cause the pain is happened. So that mechanism also it is not stopping that, but only it is stopping the pain realization, okay. The pain sensation only it is stopping, but its cause is not stopping. Means for what mechanism it should be cured, that is not doing, only relieving the pain, okay. So analgesics are of two types. Analgesics are of two types. Number one is opioid or narcotic analgesics, and number two is non-opioid or non-steroidal anti-inflammatory drugs, okay. So here more opioid analgesics, morphine is the most common, okay. So most important alkaloid of opium, this is from opium, on plant is there, from that it is extracted as dried juice, okay, from Papaver somniferum. The plant name is Papaver somniferum. It is having the capsule. From that capsule dried juices are extracted, okay, and that is nothing but morphine, okay. Then many other alkaloids of opium, example codeine. So less than effective codeine is there, so it is having low side effect, but morphine is having more side effect because it is the strongest analgesia, okay. So many other alkaloids of opium is codeine. So first is the morphine, okay, most important. Then thebaine, papaverine, etc. So these are the natural opioid analgesics, okay, which are extracted from plant, okay. The term opiates came from opium poppy, okay. So again this is the plant name opium poppy, from where it came, okay. So whereas opioid analgesics, any substance which produces morphine like analgesia. Means what is this meaning? Opioid analgesics, from this plant name only it is extracted, so it is any substance denoting to any substance which produce morphine like analgesia, means which is reducing the pain like morphine, okay. So that's why those are called as opioid analgesics, okay. Then classification of opioids, there are two types. One is opioid or narcotic analgesics, another one is non-opioid or non-steroidal anti-inflammatory drugs, okay. So let us go through the classification, okay. So first is the opioid agonist. So opioid agonist again is of having three subtypes. So three subtypes. Here is the B, for A, then B, then C. So opioid agonists are of three subtypes. First one is the natural opium alkaloids. So in that example is morphine and codeine. So these two drug is used in these two substance is used as drug, okay, in therapy. But thebaine, papaverine, and noscapine have no analgesic activity. Have no analgesic activity. Okay. Then second one, B category is the synthetic opioids. So examples are heroin, codeine, and hydromorphone and oxymorphone. So these are the synthetic drugs. Then C category is the B category is the semi-synthetic opioids: heroin, codeine, and hydromorphone and oxymorphone. But C category is synthetic. So pethidine. So this is very important drug we are using. Okay. Then tramadol, then methadone and dextropropoxyphene, fentanyl, alfentanil. So these are the examples. Okay. Then others also there, but up to this enough. Okay. Then second category is the opioid antagonist means you can this one remember like this is like morphine. So what is the action of morphine? So against that one, antagonist. So this one, pentazocine. So opioid agonist means the drugs which are having opioid like mechanism. So it's against which drug is working, that is nothing but pentazocine. Then other is pure opioid antagonist means these are purely antagonizing the action of opioid. Okay. And these are naloxone and naltrexone, and these two drugs is very important, very important for opioid poisoning or particularly morphine poisoning. Okay, so I will discuss that one, what is poisoning. Okay, so opioid are the receptors. Okay, according to the name, it is having receptor. So these receptors are present in brain, particularly in midbrain and medulla and brainstem, okay, amygdala. So these are the pain perception, so particularly medulla. Okay, so area of the opioid receptors. And supraspinal is nothing but medulla and amygdala, hippocampus. So these are the supraspinal region. Okay, and midbrain. Okay, and spinal is the that remaining spinal cord. Okay, so that is the these receptors are present over those locations, over those locations. Okay, so opioid receptors can be classified into three categories. Number one is mu, number two is kappa, and number three is delta. Okay, so mu is again having two categories. So number one is mu1 and number two is mu2. So mu1 is having analgesia on the supraspinal level. So already I told you what is supraspinal level means in midbrain, or you can simply remember that medulla. Okay, and means above the spinal cord. Okay, then euphoria. So these are the actions. Okay, analgesia action on supraspinal means relieving of pain. Then euphoria, then dependence. So more if using of more drugs, opioid drugs, then it will cause dependency on the drug. Okay, then mu2 receptors, these are present, these are also having analgesia but on spinal. Okay, then respiratory depression will occur, then inhibition of GI motility. So it will relieve pain, then it will cause respiratory depression on the medulla. The respiratory depression center is on the medulla. Then inhibition of GI motility means gastrointestinal tracts motility will be reduced. Okay. Then kappa receptors having analgesia effect on spinal level. Then so these are all supraspinal. Okay. And dysphoria means lowering of the hope. Okay, then psychotomimetic effect means like psychological effect. It is inducing the psychological effect. Okay, so may produce some problem towards psychology. Okay, then respiratory depression again. Then delta pro-convulsant action means it is making convulsion like action. Okay, so this is about its classifications and their actions. So this is about opioid receptors. So what is the mechanism of action here? Morphine and other opioids. Mechanism of actions here: morphine and other opioids produce their action by interacting with various opioid receptors. So how it is producing their action? By interacting with various opioid receptors. So what are the opioid receptors? Already I mentioned before, that is mu, delta and kappa. So these are located at spinal cord, okay, then supraspinal, those are nothing but medulla, midbrain, limbic system, cortical areas. So these locations I have drawn in psychopharmacology video, so you can go through that one and you can remember this one. So I won't explain here, okay, so later you can refer that video. So these are the area for supraspinal, okay, then and peripheral nerves, means what are the peripheral nerves, or whatever the nerves coming out from the spinal cord. Then the drug is morphine, pro-type drug, means through this drug the other drugs are produced, okay, pro-type drug, okay. Then pharmacological actions of morphine. Morphine has mainly CNS depressant effects, but also has stimulant effects on certain sites in the CNS. So it is particularly morphine producing CNS depressant effect. So what are the CNS depressant effect? Now mu receptor in the CNS, it will give analgesic effect, means it is reducing the pain, then sedation, then euphoria, and then this is calming, okay, or irritation is reduced, then euphoria, okay, feeling of happiness, then drowsiness, then calm, then raises pain threshold, means it is sometimes raising pain threshold because if not proper dose is given, okay. Then perception of pain and reaction to it. So that is nothing but fear, anxiety and apprehension, means reaction towards pain, okay. Both altered by these drugs, means fear, anxiety and apprehension means pain. These things are altered by the drugs, okay. So perception of pain and reaction to it is altered by these drugs according to their dose. So how much dose? It is what? In moderate dose, okay. In moderate dose, relieve dull and continuous pain. Mean if you are getting dull pain and it is continuing, that will relieve by the moderate dose of morphine. Then severe intermittent pain, means the pain which is very severe but gradually it is coming, when it's stopping, again after some time it is starting, so like that with intervals the pain is happening, that is called severe intermittent, but it is very much severe, okay. So such as traumatic, means due to some trauma, okay, means a psychological problem or anything, or hemorrhage or anything due to some trauma or accident, okay. Or visceral pain, means in viscera, means in abdomen or chest, means internal organs, chest internal organs or abdominal internal organs or pelvic internal organs. So these are nothing but visceral. So in those organs if some pain is occurring, so traumatic and visceral pain also reduced, but it need larger dose of morphine, okay. Then what is the action of morphine on CNS? What is the action of morphine on CNS? So morphine produces vasodilation, means on cardiovascular system, on heart it is having vasodilation effect, means particularly in blood vessels, and fall in BP will cause, okay. Then on GIT, morphine causing constipation directly on the GIT, constipation directly on the GIT, okay. So morphine will cause constipation, means there is no proper defecation will produced, okay. So problem in defecation, so that is called constipation, directly it is producing constipation activity. Then CNS action decreases GI motility, again CNS action decreases GI motility, means on CNS morphine is acting, so it is reducing the GI motility, okay, gastrointestinal tract motility, and by that way it is increasing the tone of sphincter, okay, and sphincter is relaxed, okay. Then on urinary bladder, cause urinary retention, means difficulty in urination, okay. So urine will be stopped in the urinary bladder, okay, by increasing the tone of urethral sphincter, means it is closing the sphincter, okay. Then micturition or urination problem is occurring. Then on bronchi, means on lungs, So whoever having lungs problem like asthma, if they are taking morphine, it is very dangerous for them. So shouldn't take morphine drug. Okay. So morphine can cause bronchospasm. Morphine can cause bronchospasm. Means sudden contraction and relaxation of the bronchi. Okay, what is bronchi? So this is the bifurcated two airways of the trachea. So bronchi. So it will cause bronchospasm, contraction, sudden contraction of the bronchi. Okay. So it will cause restriction of the air passages. So that's why morphine is dangerous. Okay. So and relaxing and releasing histamine. So which is responsible for inflammatory reaction. Okay. So this is histamine is for inflammatory reaction. Okay. So it is releasing the histamine. By that way, inflammation will occur. Okay. From the mast cell. So the cell is nothing but which is responsible for inflammation and releasing the histamine, that is called mast cells. Okay. In that particular area. And sixth one is intrabiliary pressure will produce. Intrabiliary means biliary duct is there, so in that it will produce pressure by increasing the tone of sphincter of the OD. So that sphincter which is closing the biliary bladder. Okay, so that will be that is the sphincter present, that is called sphincter of OD. Okay, so that tone will be increased. Okay. Then pharmacokinetic, what is the pharmacokinetic of morphine? So absorbed, this is absorbed slowly, okay, by oral administration. If it is given by orally, so absorbed slowly, and first pass effect is there. What is first pass effect? If it is metabolized by the liver. Okay, so if given by oral, so it is passing through liver metabolism, so first pass metabolism will occur. So complete distribution of the morphine will not occur. Okay, so bioavailability is poor. So bioavailability is nothing but the concentration of drug which is reaching to the systemic circulation for the action or towards the site of action, it is not reaching properly. So that's why it is poor with oral administration of the morphine. So intramuscular or IV is given because this is effective. There is no first pass metabolism. So directly it can reach to the systemic circulation and to the site of action. So by that way it can cross placental barrier. So it is not useful for pregnant women. So in place of this morphine for relaxation of pain for women, it is given pethidine. Okay. So already I told you that pethidine is the other drug beside morphine. Okay, pain reliever for mother. Okay, who is going to born child or who is under pregnancy. Okay, so for them pethidine is the useful, but this is not useful because this is having more side effects. Then liver metabolism it is having. Then morphine by glucuronide conjugation it is metabolized in the liver, and morphine this morphine 6-glucuronide is more effective than morphine. So natural morphine, and this is somewhat since processed morphine. So morphine 6-glucuronide is more effective than morphine. Okay. Now what are the side effects of morphine? So nausea and vomiting, constipation, then respiratory depression, hypotension, drowsiness, confusion, itching, skin rashes, and difficulty in micturition. So these are the side effects of morphine. So other drugs like codeine is also natural pain reliever analgesia. So that is used as pain relief. So this is codeine is used for antitussive purpose. So what is antitussive? Means if cough is not coming because the suppression of respiratory tract, so it is not that much suppressing the respiratory tract, so cough is dry cough is suppressed. So codeine has analgesic and cough suppressant effect. It is less potent analgesic, but morphine is more potent analgesic, but codeine is less potent analgesic and has less respiratory depressant effect, but morphine is having more respiratory depressant effect. Okay. Then codeine is less constipating, means it is not producing constipation, means less, very little, okay, or no constipation by taking codeine, and has low addiction liability. Codeine has low addiction liability, means there is low chances of addiction or dependency of on codeine, but morphine can produce dependency. And morphine can cause acute morphine poisoning, that will cause by symptoms are respiratory depression, then pinpoint pupils, means your pupil size will be very means pin like it will come, okay, and it will cause coma also. And the symptoms are cyanosis, means it will cause bluish or grayish color on the nail or beside the eye or skin, okay. So these are the symptoms, and shock and convulsions will come. So death will usually occur due to respiratory depression. So what are the treatment of morphine poisoning? Hospitalization should be done. The patient should be taken to hospital and maintain airway, breathing and circulation, then ventilation support, positive pressure respiration, then gastric lavage with potassium permanganate should be supplied, then specific antidote, that is naloxone. So if morphine poisoning is occurred, so naloxone should be given of dose 0.4 to 0.8 mg intravenously IV, okay. Dose should be repeated until respiratory depression should be reduced or totally eradicated, okay. So until respiration should be normal. So what is the antidote of morphine poisoning? That is naloxone. What is the dose? 0.4 to 0.8 mg IV intravenously, okay. So this is the strongest antagonist, means it is working against opioid receptors if morphine is causing poisoning. So if this naloxone is given to that patient, so it will cause the release of the morphine effect by competitively inhibiting the action of the morphine. That is the drug is called pure antagonist, naloxone, okay. So naloxone is a pure antagonist and competitively blocks opioid receptors and rapidly reverses the respiratory depression, okay. Because if someone is getting respiratory depression, it will cause death and coma and death, okay. And duration of action of naloxone is very short, that's why it should be given repeatedly, okay. Then administration of naloxone to morphine addicts should be cautious because it may precipitate several withdrawal symptoms. It means that if someone is addicted with morphine, so it should be given cautiously. Without that, it may cause again adverse effect, okay. So contraindications means patients who are having head injury, bronchial asthma, chronic obstructive pulmonary disease. So these patients shouldn't be given that naloxone or morphine, okay, particularly morphine. Then hypotensive states means who are suffering from low blood pressure. So those patients should not take in morphine, okay. If taken, it should be with care, okay. Then hypothyroidism and hypopituitarism, the patients which are having hypothyroidism means not proper maintenance of thyroid gland, then those patients should not be given morphine also. Infants and old people, because these are also effective towards morphine poisoning, okay. Then undiagnosed abdominal pain means before surgery or something, if someone is going to some doctor is going to do, so before that one also it should be take care to give the morphine because of the again maybe poisoning effect, okay. Then other effective drug is pethidine, already I told you. This is in oral and IV, SC, IM, all through the routes we can give, and it is useful for pregnant women, okay, because this is well observed in GI and bioavailability is 50% because first pass effect and widely distributed and crossing the placental barrier as well, and metabolized in liver and excreted in urine, okay. So what are the therapeutic use of pethidine? As an analgesic, same as morphine, but low side effect, low poisoning effect, and pre-anesthetic medication means before giving anesthesia, okay, general anesthesia particularly, it is given, okay, so to avoid the dependency of the anesthesia or side effect of the analgesia. Then obstetrical analgesia, pethidine is preferred over morphine, means already I told you that for pregnant women, okay, take care of the women, okay. Then side effects are similar to those of morphine but less. It can cause tremors, hallucinations, and muscle twitches and rarely convulsions. Okay, so these are all about pethidine, and its metabolite is norpethidine. Okay, and it can be tolerated dependence and psychological dependence can occur with pethidine the patient. So every time whatever the drugs we are given or taken, so care should be done. So this is all about analgesia, how to relieve pain, and what are the major drugs, and what are the uses, what are the effects. So all I told you. Okay, so up to here this video I am ending. So hope so that you understood, and please like, share and subscribe the channel. Thank you for watching.